A question I get asked all the time regarding ingrown toenails is how to prevent them. So basically is the way you cut your toenails. It's a very important thing and it sounds pretty basic, but sometimes we just do the opposite of what is needed. When you have a toenail, it has a curvature, just a natural curvature to it. So what most people want to do is just kind of follow the curvature and cut. What happens is that they end up cutting too deep into that corner. A lot of people think it's actually the toenail. It's the soft tissue around the ingrown toenail that gets inflamed and starts being painful. So the way you prevent it is the way you cut them. So what I recommend is just cut straight across, and then with the file, just go around the corners and file the corners around. And then you don't have to dig into the corners because that creates a worse scenario. So let's say you do have an ingrown toenail. The thing that I recommend to do right after you start having pain, so it doesn't get much worse, is just basically start doing some soaks in Epsom salt. What most people do is they go in there and try to dig that ingrown toenail out. And that is the worst thing you can do because all you're doing is just aggravating the soft tissues again and creating a bigger problem and sometimes even getting the ingrown infected, which then at that point you really do need to see a specialist. So most people do not know that there is a permanent procedure you can get done, a partial nail microsectomy. And it's a very simple in-office procedure that we do. And what we end up doing is just cutting just the side of that toenail where you have the pain to the root, and you put a chemical there so then it doesn't grow back out anymore. So your nail still looks about the same. You'll never know that you got anything done, but that side of the nail won't come out, and then you eliminate these chronic ingrown toenails that you can have. If you're experiencing any discomfort or pain in your foot and ankle, feel free to call us. Even if it's just a question, we're here for you.